Ben Cormack here. Welcome to this new series of videos looking at common concepts in musculoskeletal health, mostly back pain, and whether you are a clinician or you are a patient or just someone interested in pain, then these videos might just be for you. So firstly, we are going to take a look at the confusing world of non-specific low back pain or just common low back pain. And this accounts for around 90% of back pain out there in the world. So what the hell does it mean? Well, firstly, it means it's not something serious. So serious back pain accounts for about 1% of back pain. This could be things such as fracture, it could be cancer, it could be cauda equina, it could be infection, anything that might require medical intervention and maybe quite urgent medical intervention. But as I said before, good news, this is pretty rare stuff. Now, next up, it isn't something radicular or nerve root related. This could be radicular pain, that's to do with the nerve root, likely felt in the leg. It could be radiculopathy, which is nerve function, or stenosis, which is more of an acquired problem over time, something we call neurogenic claudications, do with the nerves and blood and stuff like that. So it's really good in the sense that, great news, this is not something serious, and actually it's also not something specific we can identify back to the nerves and the nerve roots. So, good news, but what the hell still does non-specific low back pain mean? Well, again, it is a nebulous term. And some people might construe or understand it as we don't know. And I think that's incorrect. I think we do know, but maybe we don't know exactly. So potentially we could view it as a failure of our clinical testing. So could it be a disc? Could it be a ligament? Could it be the joint, one of the joints in the back? Could it be muscular, etc.? So we have all of these tissues in a very small space, and our clinical testing, which is just really stress or provocative testing, isn't good at differentiating exactly which one. So it's not that we don't know, it's that sometimes we don't know exactly. But again, there is a silver lining, there is some good news here, and that is that even though we don't know exactly which tissue, we can hypothesize, we can guess, even though we don't know exactly which tissue, at the same time, we know they tend to get better at a similar kind of time frames. We have this kind of 2 to 6 week kind of window that we see episodes of lower back pain tend to recover within. And it might be some tissues take a couple of weeks, and it might be some tissues take, a little bit longer, like a ligament might take 6 or 8 weeks. It's hard to define right now. Sometimes when we look back, that might actually help our hypothesis a little bit, but we've got really, really good data that even though we can't identify these tissues, they don't need specific treatment. Specific treatment doesn't seem to make much difference here, and these things do seem to recover. Now, there is a caveat to that. Lower back pain, non-specific lower back pain does tend to reoccur. So it does come back. And maybe that's because it doesn't just have to do with the tissue, although we may describe it as presumed musculoskeletal in origin. We know that back pain, whether it is specific or non-specific, can be affected by a whole bunch of other factors as well. Whether they initiate the problem, we don't know, but they are certainly involved in the maintenance of the problem and the prognosis of the problem. So how long does that problem last for? This could be associated health conditions such as comorbidity. It could be how much we expect to get better. It could be our ability to do things with pain. There are a whole bunch of other factors that are involved: anxiety, depression, lifestyle. And actually these things aren't just involved in back pain, they're involved in, pain in general, whether that's other musculoskeletal sites or chronic pain. They're also involved with lots of other health conditions as well. So it's important to understand that dysregulation of the human system in terms of these factors often kind of impacts negatively on our health. So summing up, non-specific back pain, almost we could say that's a good thing. It means it isn't something serious and it isn't something specific such as the nerve and the nerve root, which can negatively impact the prognosis of the problem. We know that there's quite a decent definite window that this is going to recover in, although it can come back. We also know there are other factors that we can work on or understand that may be impacting this as well that are non-muscular skeletal. But please don't worry, don't fret, this is not serious, it's not dangerous. Although I will leave you with one term that I use, although it's not seriously or serious from a medical perspective, it is seriously painful and it is seriously disruptive. So we shouldn't equate medical seriousness with the serious impact on our lives and our existence, because guess what? It hurts, and that hurt can cause problems, even though it may not, injure or kill us or be a huge medical problem. It still impacts on our life. So non-specific lower back pain, likely to have some tissue involvement, likely to be quite short-lived, likely to come back, likely to be influenced by other factors, but it's not likely to be harmful, dangerous, or medically serious. I'm Ben Cormack. Thank you for listening.